The rates of kids that are not fully vaccinated, the highest they've ever been. The rates of parents asking for exemption, the highest they've ever been. Perfectly working vaccine is an amazing thing. That's a miracle. If you give someone a pill and they never get a disease, that's great. Nobody's against that. The question is, at what cost?
All right, Joel, this has been a long time coming. Thanks for being here.
Thanks for having me here.
So we are going to walk the tightrope or the third rail, depending how you want to think about it. I mean, you're putting out a book on vaccines while there is also a national outbreak of measles. Your timing is interesting. I think you called this book a Pyrrhic victory. I hope it is a victory for you. And a victory for all of us, really, to be able to actually engage in sane public discourse around an issue that seems pregnant with politics and polarization. So maybe let's just start there. Like, do you feel that there has been a sort of thawing in the ability to actually have a conversation about vaccines? And if so, what has brought that to the bear?
I think a little bit. So, going back for me a little bit, as a pediatrician who's more integrative minded, one of the things that individuals come to me most for, I've noticed over the last 5 to 10 years, is a discussion around vaccines. I've seen that online. That's what people have questions about. And in the office, of course, I talk about it, but I never really felt comfortable talking about it anywhere else. And it really was extraordinarily censored for as long as I can remember, the last decade or so. I mean, it really was. And it was really tough to talk about it. I should have, maybe, but I didn't feel comfortable and nobody really was. And I think after the pandemic and throughout the pandemic, people's eyes were really opened up to a lot. They're really opened up to the way that maybe a vaccine comes out, maybe the way that things are run, maybe the things that we're told that aren't always necessarily true. And so people were a little bit more open to having discussions. That mixed with the social media environment, which has changed drastically over the last year or two, where it does seem like people are more willing to have a conversation. Even just the word vaccine, you posted it before, things would get censored. Yeah. It doesn't seem to be happening anymore. And to me, the reason why I wanted to write a book was really just to have the discussion and have a debate about vaccines. There should be no topic that's off limits. Certainly not something that we're giving many of to our children shouldn't be off the table. And I shouldn't feel like I can't talk about it as a pediatrician. I'm not against vaccines. I think that a perfectly working vaccine is an amazing thing, but we have to have discussions about side effects and risks, and everything has risks, and it shouldn't be off the table. But it does seem like it is that way. And if you look at any of the books out there, they're very one-sided. Like, there really is nothing in the middle that I know of. I read pretty much every book that I could for this, and it's either vaccines are the best thing in the world or they're the worst thing in the world. And that doesn't help the majority of parents that are somewhere in the middle. That are most parents in my office that want to do them but want to talk about it.
Yeah, so how does one actually walk the middle path as it pertains to vaccines? Because is it a process of essentially doing a risk-benefit analysis, on an individual basis? And of course, vaccines are in a tricky topic because they actually require mass adoption for immunity to really be effective, right? So you need sort of mass buy-in in order to actually achieve some degree of herd immunity and protect the immunocompromised, et cetera. So actually, how do you carve out that sensitive middle?
Yeah, well, I think the first point of that is it's nuance, right? Everybody wants to make vaccines black and white. Like, you need to do it or you don't do it. And if you don't do it, you're the worst person. Or if you give your kid a vaccine, you're the worst human ever. It's like there's no nuance in right. Something in the middle. There's no discussion about risk versus benefits. And that conversation was brought to the forefront, and why I think so many people are upset with the pandemic, with the phrase safe and effective, because it was just said over and over and over again, as opposed to what was true, which was or what should have been said, which was, based on the information that we know, the benefits seem to outweigh the risks. Here's why we're saying that. Here's why we're recommending it. We don't know anything about long-term safety, but here's what we know, and here's why we're recommending it and to who. That's honest information. Safe and effective doesn't make any sense because you don't know what's going to happen to you in 10 years if it hasn't been 10 years, but nobody expects that. So I think that opened things up to people to get a little bit frustrated over, like, okay, what are they not telling us? And like you said, it's such a nuanced conversation because you have a discussion around the vaccines and the benefits for you. Then there's a discussion about benefits for other people. Not every vaccine has anything to do with herd immunity. Some vaccines do. Some vaccines, it makes a big difference for the community. Other vaccines, it has no difference. And just because something can create herd immunity, or just because we have a vaccine for something, does it mean that we should do it? How many vaccines are too many? Like, these are all conversations that we need to have because, again, there's a nuance. If we just keep adding more and more, then those small risks can start to add up. And what are those risks actually? Like, how do we know what the long-term risks are for a lot of these vaccines if we're not studying it?
Yeah. Yeah, I agree. I think with COVID was such a unique, sort of imperfect storm, if you will, because there was obviously a rush to get out a vaccine for some legitimate, justifiable reasons, right? There were, clinical trials. Some of that data was published. Some of it didn't seem to be published, but they were running through, placebo-controlled large studies. I mean, I think the Pfizer, the third stage Pfizer, or the third phase Pfizer study had like 44,000 people in it, 22,000 in the placebo group. I think Moderna was more like 20,000. So there was like significant amounts of people enlisted. I think where you're getting at, which I agree with, is that the public messaging around it was absolutely pathetic. That if there had been a more honest attempt to say, like, hey, this is a very peculiar situation. We are trying an old technology, or tested technology, mRNA, but never applied to a vaccine. And let's just cubbyhole the fact that there were some old school COVID vaccines like coming out of India and China and Russia and stuff like that, that were like attenuated virus vaccines and stuff. Maybe we'll talk about those because it was interesting because we never really talked about those over here.
True.
But we were focused on Pfizer and Moderna mRNA vaccines, which were a new technology as applied to vaccines, certainly mass distribution of vaccines. And there was no, hey, I'm not sure you can be a government official and just say, we're doing the best we can, and the ground conditions are moving, and this is a very peculiar situation, and there is something known as this precautionary principle, and we're sort of following that right now. But I don't know that, obviously, we never got there to that level of transparency. And, I think one of the lessons of Taoism is like, when you don't trust the people, you make them untrustworthy. And I think that that's what we ended up seeing.
No question about it. Again, just like you said, there's only so much information you could have at a certain point. Their trials, as trials go for a new product, were actually not bad, especially compared to the other childhood vaccines on the schedule. I mean, a lot of those trials are terrible compared to the ones that we had for COVID vaccines. So those actually weren't bad. But again, it was a company doing their own research. So they obviously have every incentive to show the best things and not show the worst things. The information was not readily available for everybody to look at and to go through. And we were just told to do it. And people were effectively forced to do it. And I think that really made people upset and push back because it's not like it shouldn't be made available for people. I think there were people that it could certainly help. And that's great. I mean, it should be available just like any vaccine we have. There's a plus and a minus, and we have to decide who it's right for. Everybody's different. Everybody has different genetics and conditions and environment. But with that push, with that movement, it really pushed people back and away from medicine. And this slide that we were already seeing from trust was really destroyed over the pandemic. Before, it was like 70+% of people had faith in medicine, liked doctors. Now it's like under 40% or around 40%. It's a huge difference. We're seeing the rates of unvaccinated kids are the highest they've ever been. The rates of kids that are not fully vaccinated, the highest they've ever been. The rates of parents asking for exemption, the highest they've ever been. So the very thing that medicine was trying to prevent, hesitancy, they actually created it by not having the discussion.
Yeah, 100%. I read in your book some of those decreasing percentages of adoption. And they didn't seem huge, but actually they are pretty significant when you're looking at actually population numbers.
They are significant because they're getting at a trend of belief, right? And if the belief is we don't trust vaccines, we don't trust medicine, we don't trust hospitals, we don't trust society, then it's going to compound as it gets more. This information is going to get out there.
Yeah, I think there was this opportunity to educate the American populace around first, like the ground conditions of American health. Really, when you started to examine who was contracting COVID most severely, kind of resulting in hospitalizations and unfortunately fatalities, it was those with multiple comorbidities, right?
Exactly.
So obesity, diabetes, etc. I got it really, really badly a couple of times, and I was like, I had prediabetes. I was 70 pounds heavier at that juncture. It really it was one of the kind of inflection points in my own personal life. But in some ways, we made this monotone policy, in some ways because I think we were making a lowest common denominator policy because we're so sick as a population. Mm-hmm. So there was that. But then there was also this opportunity to actually educate around vaccinology in general. And maybe you could spend a little bit of time hovering there, and we'll try to, if possible, strip back the politics, because you do talk about this in the book. And I think it's important that we kind of understand what vaccinology actually is at its basic level.
Yeah, to your first point, I think it is so important to mention what you said, which is we failed so amazingly during the pandemic. At you can take the vaccines out of it totally for a second. We had such a great opportunity to work on our health as a society. We know, if there's one thing we know from this pandemic, is that people with comorbidities and other conditions, that's what was the big trigger for serious disease. So we could have focused on improving that, and that would have made such a big difference. And we had everybody's attention at that time. And what did we do? We did the opposite. We stayed inside. We had worse food. We didn't move. We increased stress. All the things that are opposite of health, that's what we did. And we had this amazing opportunity to kind of galvanize around health, and we put so much money into vaccines. The only thing we heard was vaccines, 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 and that was by design, because anything outside of that, even Paul Offit said it, that was by design to do anything possible to not create hesitancy. Even Mark Zuckerberg said the government was pressuring them to take down real information that was true because they didn't want to do anything that create hesitancy. That is not going to work long term. People saw through that. They're seeing through it now. And now they don't know what to trust. And when you're talking about adding more vaccines and doing more medical products, you aren't going to get buy-in by not listening to the concerns that parents have. So I think that's really important. And you go back to the basics of a vaccine, like you were asking. So a perfectly working vaccine is an amazing thing. That's a miracle. If you give someone a pill or give something and they never get a disease, that's great. Nobody's against that. The question is at what cost? That's the question that we're not asking. Yeah. Yes, you can prevent a disease. And I think they do. I mean, there's tons of evidence that vaccines can work really, really well if it's working well. But the question is at what cost? And if you're getting a vaccine, you're basically giving somebody the disease or a part of the disease, something that's weakened or killed, or a protein. There's many different kinds of vaccines, but whichever format, you're giving to them in a way that they give a small immune response. That way they can make some memory, create some antibodies. That way, if you're exposed to that disease in the future, you've already mounted a response and you have basically the fighting team there to come get that disease before you get really sick. So you're not getting the actual disease, you're getting an attenuated disease, you're getting a killed disease, you're getting a portion of the disease, but you're creating a memory so your body's ready to react to that in the future. That's a good thing. Yeah. The concern that some parents have is at what cost? What are the risks? What are the long-term risks? How is that affecting their body, their immune system? How are 4 vaccines on a day, does that make a difference? 10 vaccines.
Yeah, I think this is really an important point, because stripped of all the politics, what a vaccine does in its best aspects is leverage your own immune system, right?
Right.
So let's go back to Edward Jenner, for example. He had this hypothesis he's going to take a little pus from a cowpox, right, and smear it into an open wound on a kid, I think it was, right? And essentially, in response to that pathogen, the body then spins up proteins that we call antibodies until like ding, 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 it finds the right one that can then be essentially like neuter that antigen. And like you said, it stores that memory in these B cells and stuff such that if you were to contract that virus again in the real world, you would have pre-stored essentially antibodies or a defense system for that. And that seems to, sometimes I don't think people actually grok that basic concept. And I think in your book, I didn't know this, or maybe you mentioned this in your book, is that vaccinology, the word actually came from vaca.
From cow,
right?
yeah.
From
Because
cow.
so that's where it came from, right? Because it was from the milkmaids and they were not getting smallpox, or some of them were not getting smallpox. And so they recognized, well, maybe that disease, which is similar, is giving you some sort of immunity to the worse smallpox. And so that's where that discussion came from, which is similar to why if you get a disease, you usually don't get it again, because your body mounts an immune response, you get a memory, and therefore if you're exposed to it later in life, if you have good immune response to it, then you don't ever get it again. Right. And so that's where like the perfectly working vaccine, you get a vaccine, you never get that disease in your life. It's not always, doesn't always work that way, but that would be ideal.
Yeah, and then you have to weigh that it's the risk benefit, right? So with something like smallpox, which I believe killed somewhere between 300 and 400 million people in the 20th century alone, and our memories are short, or some of us obviously weren't alive. I think because by 1980, 1977 or something, yeah, it was essentially deemed eradicated by the WHO. But, you go back into like my parents' generation, they're in their 80s, like smallpox was a thing, and we've essentially erased that from our communal memories. And so I think in some ways, like our population hasn't really necessarily doesn't embrace the utility of vaccines like my parents' generation did.
That's such a good point, because that's where I think one of the big fractures between parents and the medical world is that fact, because doctors do see it, right? Doctors do see the worst things. They work in the ICU, especially the older doctors have seen Haemophilus influenza cause meningitis. They've seen kids with whooping cough die. They've seen kids get measles and get really sick. If you go, the older doctors, maybe they've seen diphtheria cases or other things, right? And so they know the worst side of it, but parents don't see that. Parents see chronic disease, they see asthma, they see allergies, they see peanut allergies, they see autism, they see all of these other things that are exploding. And so they have a little bit different frame of reference and a little bit different worry. And I don't think that those two worlds really get the other side sometimes. And so there's this, I think, disconnect between what people are worried about. A lot of parents are not that worried about infections because they've never seen it and they've never seen what some of these diseases can do. But that still doesn't negate the fact that it's reasonable to have concerns about side effects from a product that you give your kids.
Yeah, that is such an interesting observation. I had never really thought about that bifurcated lens through which people are experiencing the phenomena of vaccines. From the medical side, we're like, okay, look, we're stopping the onset of disease, et cetera. From the parent side, oh, wait a minute, hold on, my kid has autism or some learning disability or asthma or allergies. Could it be because of this schedule?
Right. And that's what you hear. That's what you see online. And every single person knows somebody who's got a friend with asthma or 25% of kids have some sort of allergic type condition, right? Autism is 1 in 36, 1 in 22 in California. Chronic disease rates are somewhere between 25 and 50%. So we see that a lot. Parents see a lot. They've never seen measles. They've never seen diphtheria.
Yeah.
They've probably never seen hepatitis B. And they wonder, well, why should I give that to my kid on the first day of life? I'm hearing that maybe it's related to other things. I'm nervous about doing that. And nobody seems to be discussing it. They just say, no, vaccines are perfect and you should get them. And that's not good enough, especially after the pandemic where they watched a vaccine roll out. People were told that it's safe. People get side effects. It's rare, but it happens. And maybe they had a reaction themselves.
Yeah.
And So I think that's something that's more recent in people's minds, and the other things are not.
Yeah, well, and I think where the trust really began to erode was when breakthrough cases, and I'm specifically talking about COVID, when breakthrough cases became so rampant, right?
Which was a big mistake on health, because that was always going to happen.
That was always going to happen. And this was the opportunity, again, that was missed. And maybe you can help me, because this is my theory. But like, we mapped the genome of SARS-CoV-2 really early on, and basically discovered like the spike protein, right? And the sequence, even the amino acid sequence of that spike protein, et cetera. And that's why I think like the second they actually mapped it, the vaccine was developed like in a day, right? And then it just took essentially 11 months of trials and things like that. And then, to bring it to market and get the emergency use, whatever, sign off on it. But as I kind of understood, the efficacy of the mRNA vaccines became basically decreased over time, because the virus itself was mutating. So from a virus's eye view of the universe, it just wants to survive like we do, right? So it will, but the life of a virus, not like our lives are very long, right? So it's hard to actually, evolve. Humans evolve very, very slow. But like, we heard about, for example, Delta and Omicron, because those were the most pronounced mutations of the virus. But the virus was mutating like billions of times, right? It's just every once in a while it would land on a particular mutation that seemed to have like a higher R0 or slightly maybe higher or different fatality rate. But the vaccine itself was engineered for the sort of ancestral virus, the original virus. So over time, as far as I would understood it, it became less and less effective at stopping transmission. And then people's trust in it began to erode, because the public messaging around it was like, if you get the vaccine, you can't get it and you can't transmit it. That was unfortunately
very correct.
Yeah.
And so even before I say that, I think that one of the most interesting things about the COVID vaccine is there are two different worlds of information out there, and the two of them never talk to each other. You have the COVID vaccine is great, and it saved millions of lives and saved trillions of dollars. And then you have a whole alternative world where it's the worst thing in the world and it needs to be taken off the market and it's killing people and it's causing all sorts of problems. And the fact that those two worlds can't come together and talk and speak and like figure out where it is in the middle, because I'm sure it's in the middle somewhere like everything else, that's a big problem. And it's really tough for the average individual who doesn't really care about vaccines, just wants to get on with their life, to understand, like, is this the worst thing in the world or is this the best thing in the world? I don't know. I mean, just so I think that's frustrating. But the messaging was terrible because it was a respiratory virus, and there is no precedent for the fact that we're going to be able to control a respiratory virus. Like, flu is the most obvious example, because people know about the flu all the time. It changes so much. Right. So frequently, to the point that they can't even figure out how to make a vaccine that works that well any given year, because they have to guess at what the strains are going to be, because it mutates so much every single year. Right. That's the way respiratory viruses work, because they mutate a lot. And so the point of a respiratory vaccine at this point should be you're trying to minimize the severe consequences. You're trying to minimize your risk of death. You're trying to minimize your risk from going to the hospital. Maybe can minimize your risk of getting the disease, but probably not. I mean, people are still going to get mild disease. You're still going to get the flu. If you get the flu shot, some people will. So it's not going to be perfect. And it's certainly, or most likely, not going to work in a couple of years because it mutates so much. That is the way that it's going to work. That's the way any respiratory vaccine is going to work, unless we figure out some other kind of technology. Smallpox, measles, those vaccines work much better because there's such a long incubation period. So such a long period between when you get the virus and when you get sick, that if you have any sort of immunity before, you have enough time to kill it off before someone can spread it. With a respiratory virus, it's a couple of days. Right. You're probably contagious before you even know it. So you're still going to keep spreading it around everywhere. Even if you have a vaccine, because people still get it. It's not perfect. So I think that's a big difference. And so the messaging was terrible because they were not going to stop it. Right. That wasn't going to happen.
And if they could have explained just even that basic kind of evolutionary biology or basic virology of like, hey, this virus is mutating, hence the actual original formulation of these mRNA vaccines are less effective because of that mutation. And so, but at the same time, they do seem to, they might not be prophylactic against transmission, but the data, as we can best assess it, seems to show that it's still pretty effective at decreasing hospitalization and death rates. And that's the data that I've been able to sort of try to grok overall.
But that's a very different message, because then there's no, I don't think there's really a reason to force people to do anything. But then there's really a very minimal reason to say, you need to get this to protect grandma, to protect the other people, because that is very different. If you are protecting yourself from serious disease, then you have the choice if you want to take that risk and do it, because you're basically saying, look, we think you're going to decrease your risk of going to the hospital by whatever, 25%, whatever number it is. We don't know what your risk from the disease is. You could grow a third arm in 10 years. We don't know that. Do you want to take that risk, right? And that's what people can make a decision. Do you want to do that for yourself or not? That was not the messaging. And people really felt frustrated, I think, after the fact, because they realized that they were not necessarily protecting other people.
Yeah, there was no really true informed consent. I mean, I remember I waited for a good, as long as I felt it was responsible. And when Delta came, which I believe that mutation sort of reared its head in late summer of 2021, if my memory serves me correctly.
Sounds about right.
Yeah. And so that's when, and I was doing some traveling. And so that's when I ended up getting vaccinated. But that was like, in some ways waiting, and just to see as much, to understand as much of it as I possibly could before making a decision for my personal self. I think at that juncture, it appeared that that getting some vaccination might decrease the risk of transmission just because the incubation period would be shorter. But again, it's a little bit tricky to say. I think maybe we can touch upon some other areas of your book. I think one of the other issues that a lot of people have around vaccines is the liability shield that big pharma has. So maybe can you explain the provenance a little bit of why in the mid 80s Reagan started the NCVIA, I believe it was, and what are the arguments sort of pro and con kind of shielding pharma from some liability?
So before that, so we're talking like 50s, 60s, 70s, we had the smallpox vaccine, then that went away. You had the diphtheria, tetanus, pertussis, you had polio, and then you had the MMR, measles, mumps, rubella. So that was all in the middle of the 1950s, 1960s, 1970s. In the late 70s, early 80s, there began to be increasing concern around side effects around the vaccines, especially the DTP vaccine. The big concern was around neurologic complications, encephalitis, seizures. It was never totally proven to be causative, but there were lots of concerns around it. So there were lots of lawsuits that started to pop up. And because of all these lawsuits, a bunch of vaccine companies left the market because they weren't willing to take that risk anymore. And there was a lot of concern amongst the administration, science, that all the companies would kind of pull from the market and we'd have no more vaccines because there would be so many lawsuits that would pull them from wanting to make vaccines anymore. So at that time in 1986, they enacted the Vaccine Act, which basically shielded companies from liability. The positive of that being you stabilize that market because they don't have to assume that risk anymore. Mm-hmm. The problem with it is now they don't have to have any liability for the risk. So They don't have necessarily any reason to make their products better. They have every reason to get as many products on the market as they can because it's a huge money-making item if they can get past all the research, get it on the schedule, and get millions of kids to get it every year. And you did see a huge explosion after that of vaccines entering the market. There were just a few before. There are many, many more now, like 20, 30, 40 vaccines that some kids get at this point. So it's a lot more. Some of that's good. I mean, we protect against more diseases, but that just increases some individuals' concerns because we're getting more and more, and there really isn't anybody watching over the companies anymore. I mean, there are the bodies like the CDC, the FDA, but there are some people that go back and forth, and they're not really monitoring them like they need to be.
No. And so if you are a parent, let's say, and your child has an adverse reaction to a vaccine, your option is not to take a pharmaceutical company to civil court. You go to essentially like a government court, right?
Correct.
And you have to create some burden of proof, right? It's not like, what is the burden of proof there actually?
So if you have a reaction and you want to sue, you're correct. You cannot sue the vaccine manufacturer except for very specific incidents like negligence and other things, which doesn't really happen.
Right.
So you would sue basically the HHS. And then there's a vaccine court. It's pretty standard. They have a list of things which they have decided vaccines cause. And if you meet those criteria, you basically get the amount of money they've decided. Anything outside of that, you have to prove that the vaccines caused that thing, which is basically impossible to do in a lawsuit. So you just wouldn't win.
Yeah. And I think it's capped at like $250,000.
$250,000
right?
is the max, yeah.
So what is VAERS?
So VAERS is the vaccine adverse reporting system, basically one of the ways that we monitor vaccines, the main one really at this point. So it's a self-reporting system. Anytime that anybody thinks there could have been a reaction from a vaccine, you can go in there and you can make a report. The doctor could do it, a patient could do it, the company could do it. You just go in there and you make a report about the incident that happened. So that's one major way that we have to watch over vaccines. The other one is the vaccine safety data link. So that is some HMOs, a few companies that basically have pooled medical information so they can get information from that. Those are the two main ways that we monitor vaccines after they get on the market, which is a big problem because it's nowhere near enough. And I think that's one of the major concerns that people have. And I think it's absolutely correct that there really is no good long-term monitoring of vaccines. The way that vaccines are studied, they're mostly studied pre-licensure, right? So if a company's going to study it, they're going to study it for maybe a month, maybe a couple months. A really good study might go 6 months to a year, and then they go on the market. And then you're following it after, and you have these other systems, like you can do a research study. You could look at VAERS, you could look at VSD, and they're not terrible. I mean, they certainly do find things. We found myocarditis with the COVID vaccines. They found intussusception with the rotavirus vaccine. So they do find things, but the issue is somebody has to look or think, and it's not that easy to do. Like if, let's say, for example, you get the hepatitis B vaccine today, and the hepatitis B vaccine causes cancer 10 years from now. Nobody would know that in the current system because nobody would associate that cancer, let's say a thyroid cancer. You're not going to go back into VAERS and say, oh, I got thyroid cancer from hepatitis B. The only way to know that would be to look prospectively. Right. And one day it'd be like, why are all these kids that get vaccines getting thyroid cancer that are different than the kids that are unvaccinated? We don't actually have a mechanism to do that right now. So that's a big piece of the vaccine world that's missing when people are concerned about long-term safety, because we don't actually have a good mechanism for that right now. Yeah,
it was interesting to see VAERS move into the public zeitgeist. I mean, it is a fairly obscure part of the internet. I ended up spending a lot of time there, often in response to claims that there were a lot of vaccine-induced fatalities. So there was, I think that every nurse or doctor that administered a vaccine and then that patient would die within a certain amount of time period or whatever had to file on VAERS, right? Correct. And then there was individuals also, I think, could file. And I know that, there was a lot going around the internet of like, oh my God, there's like 10,000 vaccine-induced deaths, look on VAERS, or 20,000 or whatever. So I would go to VAERS and I'd start to read them like one by one. And it was like, stage 4 metastatic cancer. It was like I read the first 20 pages or something. And I would say I didn't come across a single case where there was like a healthy person that had a vaccine-induced death. Now, that doesn't mean that that didn't happen. I'm sure there were people that actually had anaphylaxis and weren't treated. There might have been other people, and I've certainly heard accounts of people that suffered, injury or certainly myocarditis. That was one of the best uses of VAERS, right? Because it actually revealed it fairly early-ish on, and it could be addressed. But it was, this is the trickiest thing right now, kind of in the information ecosystem right now, is the leveraging of certain kinds of data for one's own bias, right? So
VAERS, you can be very biased,
Yeah.
and you can certainly find what you want to find with that, and that's why it's a very problematic data. It's great. I mean, it's a good tool. It should be there, but you can't use that for these kinds of questions in general, because it very much matters how aware you are of a situation going on and aware of VAERS. Like when there was a lot of concern about HPV vaccine when it first came out, there was a huge spike in people reporting about it. When there was the emergency use authorization in COVID, there's a huge spike in people reporting things. They're reporting everything. So is that because the COVID vaccine is causing a lot of problems, or is that because people are reporting any problem that happens around a time when they're getting a COVID vaccine? That doesn't parse that out at all, and for the most part, it's just people are more hyper aware to report things, and that doesn't help to decide, okay, is this vaccine causing any problems in the long term? And it doesn't in any way have anything to do with something that happens a couple of years from now, which many things that you take can potentially harm you in the long term. That's the question. I think that's the big piece of the puzzle that's really missing when it comes to vaccines, because you kind of asked this question before about how do you make a decision. And the true way to make decisions on a medical product is weighing the risk versus the benefits. That's what you do when you go for surgery. That's what you do if you want to take a cancer medication. Like, we know that a cancer medication, you can lose your hair, can affect your immune system, you can get really sick. But you have to weigh, well, is this going to potentially save my life? So yes, I might get these side effects, but I'm choosing to do it. Or maybe some people would not choose to take chemotherapy. That's your choice. That is the way we should also look at vaccines. We have to weigh the pros and the cons, but I think we're missing some of the information, or at least certain individuals feel like we're missing some of that information. And the answer to how to get there is not to censor those discussions. It's to understand where people feel like we're falling short on the information and figure out how do we get better information so that we can make better decisions in the future. We are not at the most intelligent place humanity is ever going to get. We're not at the best place that vaccines are ever going to be. We should always be striving to be better. And we should get that information, because if in the future we have a study that shows that, hey, this vaccine increases your risk of getting autoimmune disease, or this ingredient increases your risk for autoimmune disease, wouldn't we want to know that? Yeah. Wouldn't a doctor, they don't want to harm a patient. We would say, oh, geez, that's not good. All right, how do we change this? How do we get that ingredient out? How do we change up the formulation, change up the schedule to decrease that risk? And if you don't find anything with doing the right studies prospectively, then that's going to give parents and individuals the comfort that, look, vaccines don't cause autism. Vaccines don't cause chronic disease. I mean, whatever the thing that you're worried about, that's the research that you get that makes people more comfortable to do it, not censorship.
Yeah. So I think this is the trickiest part of the modern Rubik's Cube, because we live in an information ecosystem that can be so easily polluted. So yes, would I love sort of this John Stuart Mill marketplace of ideas where smart people like Joel can sit with other smart people and have really intelligent, thoughtful, insightful, middle of the path conversations? Yes, that would be perfect. But do I want, like, my old friend Russell Brand dispensing information about vaccines in an algorithmically preferenced way that is just laced with editorial bias and sensationalism in order to trigger human activity bias to create fear and outrage? No, I don't want that. And so it creates a debate around whether or not, like, too much information is actually a good thing for modern society. I don't have a good answer for that.
I agree with you totally about everything that you said, but I I do not think that we're having the debates or discussions about vaccines. The vast majority of any sort of vaccine discussion or debate over the last 5 to 10 years has been completely censored to the point where you couldn't even put the word on social media without getting censored. And that doesn't make any sense. Now, is Russell Brand the right person to be disseminating that information or having a debate? No, it should be people like RFK and Paul Offit sitting in a room and saying like, okay, here are some big voices in the vaccine space. Let's go sit down at Harvard or John Hopkins or, some place where we can have a good, honest discussion and debate. People can ask questions and we can figure out, well, why do people think what they think? And where is the research and the evidence? And where are the concerns that intelligent people, you don't have to agree with everything that RFK says or anybody that anything says in politics or anywhere else. But if they have legitimate questions and there isn't the research or data to answer those questions, then that's a good place to get information. Say, okay, here's where we want to do our research in the future. Here's where we want to put some money in the CDC to do some studies on this. Here's where we want Stanford to build a study going, because we can do it. We can do this research. We can look into some of these questions. It is possible if we want to.
Yeah, well, actually, let me ask you about that, about how possible or maybe how ethical it is to do prospective studies on vaccines. So I remember this incredible Jonas Salk quote. I'll totally butcher it because I don't remember it that well. But I remember when they essentially introduced the polio vaccine and there was massive public adoption and there was a huge control group. I mean, hundreds of thousands of kids, right?
Millions.
Millions, yeah. And Jonas Salk had deep misgivings with having a big placebo group because I think he said, are we going to sacrifice humanitarianism on the altar of science or something like that? And what he was getting at was this ethical dilemma of like, wait, we're not going to give these kids the polio vaccine. We're going to give them the placebo, knowing that 10, 20,000 of them might get sick. And so this has, I think, been always the ethical debate, right, about doing prospective studies around or placebo-controlled studies around vaccines. So can you kind of unpack that a little?
Yes, so that's very correct. Back then, there shouldn't have been ethical debates about that question because when you don't have a vaccine on the market, there is no reason that you shouldn't study it against an inert placebo, salt water.
Okay.
Most vaccine trials were never done in that way, and I think that's the problem. So when you hear people like RFK and other individuals talking about the problem with the research, that's what they mean. They'll sometimes say it wasn't placebo-controlled trial. It's not true. They were not inert placebo-controlled trials. So a lot of vaccines were studied against other vaccines. Right. A new vaccine is studied against the old vaccine because basically, like what you said, the ethical concern is if we have a vaccine on the market that we feel works well and that protects you from something, you should be given nothing. You should be given the protection, and we're studying the new vaccine versus the old vaccine. When you're talking about the original polio vaccines, there's no reason you couldn't have given a placebo because there wasn't anything on the market and you don't know that it worked. When you're looking at the original Prevnar vaccine for pneumococcus, they didn't study it against a placebo. They studied it against the meningococcus vaccine. Right. So you're stacking the deck a little bit by putting in something else. So you're not getting a true baseline of safety because you're studying it against a different vaccine. So potentially there are problems on both. And then if you have 3 kids get a seizure in one group and 3 kids get a seizure in another group, you could say it's safe because there's no increased risk of seizure, even though if you got 0 vaccines, maybe there'd be 0 seizures. So that's how they stack the deck a little bit with a lot of these trials, and that's the way that most of them are done. Very few trials are done with an inert placebo, almost nothing in the childhood vaccine schedule. So that's one of the big concerns from the individuals that have concerns over the research have. Could you do trials prospectively? You could do it. Could you do them blinded? That would be very difficult now because of the ethics of what you said. It would be very difficult, probably impossible at this point, to either put people in a group to get a vaccine that don't want it or to put people in a group and not give them vaccines. You're probably not going to get that study funded, but you could still do it open. You could still follow kids forward and let them choose to vaccinate or not vaccinate and give them that option throughout. And then you'll study kids that are unvaccinated. You'll study kids that are partially vaccinated. You'll study kids that are fully vaccinated, and you can look forward and follow them and see what happens. Is it the best, most perfect study? No, because there are going to be, of course, differences between the groups, but it's still very valuable information because, for example, let's say the group of kids that are not vaccinated have a 10 times lower risk of autoimmune conditions. That's good to know, right? That doesn't mean that it's because of vaccines only, but the unvaccinated lifestyle having a 10 times lower risk of autoimmune conditions, okay, then why? Right? That's still very useful information. So you can certainly do that. You could certainly use any sort of big data set that is available out there and that already has a lot of information and take the kids that are vaccinated, that are unvaccinated, that are partially vaccinated, and study them and see what kind of outcomes they have. That hasn't even really been done. And that's super easy to do. Anybody could do it. I have a master's in epidemiology. You can get that information and do it in a few minutes and look at the data, but they're not doing that. They don't want to study unvaccinated versus vaccinated kids, and it's a problem. They should. They have to. They don't want to open up the can of worms, I think. That might open up.
Yeah. Well, that might change.
I think it's going to change.
Let's probe measles for a moment. It is a hot topic given that there have been outbreaks in Texas. I think there's a little bit of an outbreak in Tennessee now. Typically, the MMR vaccine has been pretty effective. Is that right?
Based on the research, 93% effective, one vaccine, 97 for two. So that's pretty good. If you get the measles vaccine, almost for sure you're going to be protected based on what we've seen in history. And that's why measles is really, or one of the big reasons why it's really decreased, because it's a pretty good vaccine.
Mm-hmm. Now, it got painted with a brush in the late 90s. Very famously, Andrew Wakefield posted this, or with many other authors actually, put this study out in The Lancet that was subsequently redacted and then I think pulled completely off, that connected the MMR vaccine with autism. As I understand it, that was connected to... Actually, you can clear this up for me. Was that whether or not that was connected to this ingredient known as thimerosal, which is a preservative? But I don't think thimerosal was ever in the MMR vaccine, right?
Yeah. So those are two different things. So those are the two big controversies in the autism. Yeah, but separate.
But separate. Okay.
Yeah.
So the MMR vaccine has often been lumped into the autism debate. Have you, in your experience, found any compelling data to show any causation or even correlation between the MMR vaccine and autism?
I have not seen that yet. I've not seen... So the research on autism is really interesting. Of anything that I was most shocked about, it was really that research. The one vaccine that has had some research is the MMR. So really any good study that I've seen thus far doesn't really show a good connection. Same thing with thimerosal. But the issue with the autism research is that's what's been studied. There were a lot of other vaccines. So when people say the research is, the science is settled, the topic has been debunked, really what the research shows is that we can't say that measles causes autism. We can't say that thimerosal causes autism, but we really don't know anything very much about the rest of the vaccines. And so I think that is a real big disconnect, because you would think that there was a lot of research in all these other vaccines. It's actually not true. And even the measles studies in general, it's kids that got the measles vaccine versus kids that didn't get the measles vaccine in the setting of getting their other vaccines. And it was still retrospective, looking backwards. So it's still not even the best possible studies. But a lot of the discussion around autism when it comes to vaccines is there's no research to show that it causes autism, therefore it doesn't, which is true. There isn't research to show that it causes autism. So that's true. You could definitely not say that vaccines cause autism based on the research, but that's because there isn't that much research on that topic, even though they say there's so much. And I thought there was so much, and that's what I was taught. Yeah. I was taught that it's settled.
Yeah, but if you spend an evening poking around PubMed and stuff, it's actually...
It's shocking.
There's a few things, but there's nothing compelling.
I have a background in doing health research. I have done that. I did a master's in epidemiology. I did a literature review. I have a decent understanding of how to do this. I could not believe it when I went through to the point where I had to stop, step back, question whether I was not finding things. I read a bunch of books. after the fact. Like I read Paul Offit's book. I read Peter Hotez's book about vaccines. Like they don't have any more research in there. If it existed, it would be in there. But it doesn't make sense. Like that the sentiment is so strong, yet the research is there. And I don't have a position on all this stuff. I'm not trying to make anybody do anything. I say very specifically in the book, like if you think I'm wrong, find the research, send it to me. I'll change the chapter in the book. I'm happy to do it. But I just put in there what I found. I put every single step of what I did, especially for that section, because that's controversial to say, and I wasn't going into it to say this, but that is what exists, and anybody that goes and looks at it for a second will see that. And I don't think most people know. I didn't know. I don't think most doctors actually know what the research shows. And when, again, someone like RFK says we need some research on this, 10 years ago, it would have been like, oh, this is crazy. Like, you're an anti-vaccine crackpot. When you actually look at the research, yes, we do need to research this properly because that will be the information that will help people to make decisions. And if you do this and you do prospective studies and you show no difference, that'll give people a lot more confidence to say, look, we studied all the vaccines, we studied the schedule. It doesn't change anything with autism. It's not related to it. But you can't just say that there's this strong evidence and research when it doesn't actually exist.
Yeah. Do you think that part of the kind of statistics around autism, it used to be maybe like 1 in 100,000 kids. Now it's 1 in 36, even 1 in 22 in California. Is that diagnostic at all, or
part of it is?
Yeah.
There's no question that we're more aware of it. There's no question that we're better at diagnosing it, that more people are discussing it. But that hasn't changed that much in the last 20 years. And it was like 1 in 150 in 2000, and now it's like 1 in 36. So yes, a part of that is better diagnosis, but that is not what's happening. It's definitely occurring more. You look around, you see it everywhere. And autism is many things. There's very mild autism. There's a lot of adults that were never diagnosed, that got diagnosed when they were older. But then there's also this growing subset of kids that have very severe autism, very difficult family life of stimming and not able to feed themselves and not able to communicate and self-harming and all of these issues which those families are struggling with, and that subsection seems to really be increasing the severe autism from what I'm seeing.
So maybe let's talk about thimerosal just for a second so you can clear that up. So was thimerosal, I think it is still in some flu vaccines, right?
That is correct.
And then, but typically kind of back in the 90s and maybe before, was it in DTaP or what?
Yeah, it was in a lot of the vaccines that you would be getting in that first year. So like a Hep B and the DTaP, some Haemophilus influenza vaccines. So that was the main ones that it was in. So it's the mercury component. It was basically there for its antibacterial properties. So it was a preservative basically. And it was used there. So in the...
So when you had those like double dosages in a vial
right.
or something.
So the vials used to be multi-dose. So
right.
You used to, put a syringe in, you take some out, you give it to people. It's a lot cheaper, obviously, to make a bigger vial and then not have to have a single one for each person. And it's a lot more economical, especially if you're taking it to other countries and around the world because it doesn't take up as much space. So that was used in there to prevent contamination. So that's good. That's the good part of thimerosal. But the concern was the mercury.
Right.
Because around that time, individuals started to notice that the amount of mercury that you'd be getting in the vaccines was higher than the dose that was recommended was concerned about in food. And the mercury in vaccines was a little bit different, but still the dose was right. higher than what was recommended. So there was concerns about that, and no one had ever studied it right. in vaccines. And so with this concern around autism, there was this movement, and even the researchers, they didn't really know. They were studying it. They were looking into it. And it was never proven to cause autism, but they decided to take it anyways, just for safety and precaution reasons, given there was that concern around it. It was taken out. The research didn't show it. Autism rates are still going up, so I would say it's probably a low likelihood it was a causative factor. Maybe it was affecting a small subset. I don't know. But I think at this point we can hypothesize it wasn't a huge factor given autism still going up.
Right. So maybe we'll just kind of go back forward towards the COVID vaccines again, because as we've talked about, historically, there have been different kinds of vaccines, but the most famous ones have been either an attenuated virus or an inactivated virus, right? So it'll give you just the right dosage to induce an immune response, such that then you create the defense systems, right? So that's fair summary, I think. The mRNA technology was different, that instead of actually giving you a little bit of the virus or a dead virus, it was actually giving you the recipes to essentially produce a protein intracellular in the ribosomes, I suppose, that mimicked the spike protein, this famous spike protein that provided essentially the envelope by which the virus would essentially move into the cell through this ACE2 receptor, through binding to the ACE2 receptor, right? So instead of actually giving you the like a little dosage of the virus, it told your body, hey, you're going to make this spike protein. Then your body, your adaptive immune system, is going to recognize that spike protein as something foreign and then spin up an antibody against it, right? So
that's the way that I understand it. And I think that it's so interesting because it's such a new technology that we just didn't have a good understanding of what that means for your body and how it's going to react to it.
Let's leave like the virus side out of it for a second. It seems from the data that has emerged that the spike protein itself might be harmful or pathogenic irrespective of the actual virus itself. So I don't know. We don't have to go into that.
No, but I think we can say this, right? Yeah. I think there are very different opinions on it. The reality of anything is if something gets into a place it's not supposed to get, then it can cause problems. So we have all sorts of bacteria all over our skin. If your skin opens up and you get a cut and it goes to the wrong place, that normal thing that was there can cause a problem. So I would think there is no logical reason to think that if you create a protein and it goes to a location where it's not supposed to be or it's not usually going to by the normal means, then it could cause a problem like the heart. If it was to get to the heart and that's not supposed to be there and you have some sort of immune response, it could create a problem. So I don't think there's any reason you can't say maybe if it gets to the wrong place, it could create a reaction. That's not controversial. It's just saying we don't know, but like that's logical.
But with that, because I'm trying to understand why there were these increased cases of myocarditis and vaccine-induced myocarditis, right? And I don't know the answer to this. This is why I'm here talking to you. Was that vaccine-induced myocarditis due to the presence of this new spike protein that was made in response to this recipe that we delivered? I don't know.
My understanding of it is that the main theory is that the spike protein might get to a place where it's not supposed to be in the heart because it gets into your bloodstream, especially if you get injected maybe into a vein, and so you get a bigger dose, or it goes to a location like the heart. The heart doesn't really regenerate very well. Right. So if you have something where it's not supposed to be and your immune system attacks it, then there's a chance you can cause some damage to your heart, and everything is working electrically perfectly, and if you cause some damage, that could throw things off. So that's my understanding of where you can get myocarditis from, is just an immune reaction to something that's not supposed to be there, in simple terms.
Yeah. I mean, I often got into these debates mostly over the dinner table because those were the safer places to have these debates over, okay, yeah, there may be some vaccine-induced myocarditis due to the spike protein, but wouldn't there also be increased myocarditis just due to natural contraction of the disease itself? So then you're weighing, it's a little bit more apples to apples, instead of saying like, no, vaccine-induced myocarditis bad, That's correct. Also, that's the nuance of medicine, right? Right.
The counter argument from mainstream medicine would be, and generally is, for most things, well, yeah, the vaccine might cause this issue, but the disease is going to have a much higher risk to cause that same issue. So therefore, maybe there's a risk, but we're just going to ignore that risk, and you should get your vaccine because there's risk from the disease. So that's true. I mean, based on the published research, your risk of getting myocarditis from the disease is higher. The risk of getting myocarditis from any virus or most viruses is possible. That's certainly something you see. And one of the big serious complications from regular viruses, if you happen to get really unlucky, is myocarditis. If it happens from the flu or RSV or any of these viruses, that can be really severe. So it's absolutely possible. It's rare. It's not something people should be overly worried about, but it happens. And that goes back to the nuance of conversation of weighing risk versus benefits, because if you honestly said to somebody, well, your risk of getting myocarditis, yeah, it's 1 in a million, but you have a 5 in a million chance with the virus. Okay, then you know those two things, you make your decision. You might not want to, you might be like, well, I don't think I'm going to get the virus anymore because I've already had it twice and I think I'm pretty protected and I don't want that 1 in a million risk from the vaccine. That's a reasonable assumption. Potentially. That's where you have to weigh those things for yourself. Or maybe you have a pre-existing heart condition and you don't want to give yourself that risk and you're like, well, I'm going to try to avoid the disease. I don't know. Everyone's different.
Yeah, 100%. Yeah, I want to ask you more of a philosophical question. I think I was a bit of a Star Trek fan, so I think there was a famous quote from Spock, not Dr. Spock, just Spock guy, which was the needs of the many over the needs of the few, right? So that sort of encapsulates this concept of utilitarianism, right? That, you try to minimize suffering for the most amount of people, right? While like maximizing well-being for the most amount of people. So, and this has been, I think, the primary ethos that has scaffolded vaccinology. And I would say liberal democracy in general. It's like we're in a social contract with one another. And with rights comes responsibilities, et cetera. We give up some rights in order to get other rights, et cetera, versus, individualism or humanitarianism, knowing that, yes, there will always be side effects, sometimes just absolutely crippling, awful side effects. Yet we have to think of the whole instead of the individual. And this is sort of a philosophical argument, which sort of pits humanitarianism versus utilitarianism. And how do you balance that?
So I have this very section in the book because I think it is such an interesting discussion. And this is one of those debates that I think needs to be on stage. And really smart people need to discuss this because there is no easy answer to this question. I think the first part of it is you really need to have a good understanding of the vaccine landscape to have that discussion because not every vaccine has anything to do with herd immunity. Many of the vaccines don't create herd immunity. So there is no discussion there. Like certain ones that just protect you, they don't protect other people. So I think you need to understand that part first. Then there certainly are vaccines where it does have a big implication on society because there's a level to reach herd immunity and you are protecting other people potentially by getting vaccinated. So I think that's really important because obviously we want to protect individuals, but that's where their nuance comes in because as more and more vaccines come on the market and more vaccines occur and risk to you increases, there does become a point where as a parent you have to discuss and think about, if I'm worried about the risk for my own kid from certain vaccine, does that outweigh the risk to somebody else? I mean, we want to protect a kid who has, let's say, cancer, but there are a lot of viruses out there. So just because you get vaccinated from one thing doesn't totally protect them, but it probably protects them a little bit from those things spreading. So that's important. But you might have a very vulnerable child and there might be a vaccine that you don't feel like your child should get. And where is the line between protecting somebody else versus protecting your child? Where is the line where we agree on the social contract? What if the government said, well, everybody who has 2 kidneys needs to give a kidney to someone who doesn't? I mean, we have the choice to do that or not, right? And obviously giving kidneys is not the same thing as getting vaccinated, but maybe in the future you're going to say, oh, everyone's got to connect their brain to this thing to protect everybody else. Like these are kind of situations where you go, and that's obviously much farther along than getting a vaccine, but it's not, because what if you're requiring to get 5,000 vaccines, 200 vaccines? Like at what point do we start to give people autonomy and say you get to choose what you give to yourself and your child versus what we protect to other people, as we can have more and more vaccines come on the market? There isn't a very simple, there is no simple answer. I don't know the answer. That's one of the things I grapple with most, but I think it is a very interesting conversation between personal freedom and social contact and protecting other people, because both things have some truth in reality and both things are important, and everyone's gonna feel differently about about all these things and kind of weigh in different places, and forcing everybody to do it isn't necessarily the answer.
Yeah. Monotone policy in an era in today's world where access to information is so broad, I just don't think it's possible. Maybe more in the Walter Cronkite era, where maybe not everything he said was objectively true, but there was sort of an intersubjective agreement among people because these sources of information were relatively consolidated and condensed. So Walter Cronkite gets on TV, says, okay, this is what's happening. Okay, most people went along with that. That era is over. And so to actually try to enforce a sort of monolithic, monotone policy, I mean, we saw what happened, right? There was a lot of unrest with that. And, I think that better transparent communication, like if we had been able to, let's say there's another virus, right? With a mortality rate more akin to smallpox, 20 or 30% mortality rate. And let's say it preferences children, right? Heaven forbid. You would not need a monotone policy to enforce vaccine adoption.
Exactly.
Right?
That's exactly, I've said that many times. If something was so severe, you would not need to push anybody to do anything. They would just do it. They would want it. They would be lining up, just like people were doing for the polio vaccine back then. When you have this nuanced conversation where, it's not great. I mean, some people are dying, but most people do just fine. Then pushing that, enforcing that on people seems to have crossed the line. And I think it crossed the line for most people. And it certainly has led people to a place where they don't even agree with the CDC policies anymore. I mean, it's still to this day, as we're talking, still on the children's schedule at 6 months. And it's still recommended for kids and adults, but almost nobody's doing it, right? You have like maybe 20% adoption for adults. Maybe it's like 5-10% for kids right now. So the vast majority of people are not following the CDC schedule for that vaccine. Mm-hmm. So that means there's some sort of disconnect there between what the population thinks and what the authorities think. And that's a problem. Where's that discussion and the nuance and it doesn't mean it doesn't have to be available, but you could still say, well, here's why we recommend it. We recommend you go do it if you want to. Here's the reasons why. That's it. You just have this continual kind of push to do it without a discussion. And it's almost like they feel like people are not smart enough to have a discussion or a debate anymore. And it's the very opposite. If you start doing that, I think people will start to trust a little bit more and be more willing to do things knowing that there is care and thought around safety. And I feel like most people think right now that money is talking and corporations are running things and not the best interest of our kids' health, even though doctors have the best interest of kids' health. But doctors are so marketed to by pharma that we don't even know what we know anymore. We just are kind of parroting the same things over and over again. We don't realize that they own the schools that we go to, the research that we're reading, the news. You're living in a pharma world. We don't know any different than that.
Yeah, I mean, we're in this era of sort of compulsive contrarianism almost. And I find myself even sort of grappling in the dark. I'll read, I think I read the Commonwealth Fund studied how many lives were saved by the COVID vaccine in the United States. And the estimate was like 3.2 million. And I think the dollar figure was like north of $1 trillion. But in my mind, there's a little bit of like a little voice that says, well, the Commonwealth Fund, who's behind that study, right? And then I dig a little bit deeper, and then there's a bunch of doctors from Yale that have signed off. I'm like, okay, well, Yale is an institution that I've respected for a long time. I think this is probably somewhat legitimate. Yeah, I mean, I want to trust my institutions. And then I'm like, but actually who funded the study? And then, you keep
who funded
going.
Those people.
And this is the is the era in which we live where trust has been so eroded. And I think all sides bear some responsibility for that. I think the perverse incentives kind of in the information ecosystem that essentially reward sensationalism and scare tactics and scapegoating. And candidly, I think Bobby plays into some of that sometimes.
He does.
When he says things like 25% of Americans think that they know someone who was killed by the vaccine, that really troubles me when he says things like that, even though I agree with 90% of what he says about the food policy, et cetera, because what that does is sort of sow a sort of distrust that then he sometimes capitalizes on. And so this is where like I have some misgivings with him, and then I'm like,
I think we agree on that. I mean, that mostly I agree with what he says, and I think a lot of what he says is brilliant, but then he certainly sometimes like goes off on some tangent. I'm like, why are you saying that?
Why are you saying that?
Even in the book, a couple places, I'm like, a lot of what it's really interesting to listen to him talk because you pick up these things and then you go read them and you're like, that can't be true. And then you read it and it's like, that is totally true. And you're like, he talked about how to use this study in Africa in Guinea-Bissau where kids had a higher death rate after getting the DTP vaccine, like 5 times higher death rate, 10 times higher death rate. And you go look and it's like, yes, they were not dying from diphtheria, tetanus, pertussis, but on multiple studies, they had a higher overall mortality rate. And those are the things you never hear about. And you're like, if you have a higher overall mortality rate, that's not a good thing. Yeah. We need to follow that up. So those things he says are great, but then he says things like, he's talking about the Simpson wood, when we're talking about thimerosal, and there was this secret meeting where everybody went, and I read that whole, nothing in there says it's secret. I mean, maybe it was, maybe it's not, I don't know, but I couldn't find any reason to believe that it was secret. But sometimes he goes off on these tangents of hyperbole for, I don't know whether it was clicks or whatever it was back in the day.
Yeah.
But he's not always very specific, but usually he is.
Yeah, like I've never found any evidence that the virus was bioengineered to protect Ashkenazi Jews and Chinese people or whatever. There's some things that are like, okay. And then, I think, just generally around food policy and other health policy, I'm on board mostly. But I think just to the point that we've so kind of eroded trust, partially due to this kind of misaligned incentives in our information ecosystem, and then just this self-incurred embarrassment from our institutions themselves, whether they be our institutions of higher learning who are, suffering right now, right? But all the other institutions that used to prop up liberal democracy, whether that's, kind of quote unquote mainstream media or science, quote unquote, our public health agencies. I mean, and what I'm finding is that it's really easy to tear down the institutions that have long imperfectly supported our society. It's really harder to build them back up and hold them accountable. And that's what I would prefer to do because I still believe that liberal democracy is probably the best system out there. Right. I don't want to live in a totalitarian autocratic state. And so I think this is like the broader kind of more epistemological disease that we're experiencing as humanity.
I agree. There aren't easy solutions to this. It's not simple. And, even so much in whatever part I'm in with like MAHA and those kinds of things, I was talking about kids' health a long time ago,
forever,
right?
Yeah,
and this just happened to become a part of politics in the last year or two, and I think that's good. I mean, I think it's good that in some sense, like it got in the public discourse, and now we're talking about it and we're making changes. So that part's good, but it's not a political thing. It can't be a political thing. It certainly can't be a political thing going forward for any good, because this has got to be something that's bipartisan, that's about our health and our kids. But it's so much more complex than that, and you get the comment often about like, why is everyone just worried about dyes? And like, it's so much more. It is. It's not just about dyes. Like, I think that's something that people could kind of latch onto. That was simple. Dyes have the artificial dyes have no real medical benefit. They're in there because we can, and it's an easy thing that we could theoretically take out. But if we take out all the artificial dyes, are we going to be healthy? No, right? It's not that useful a thing. I think it galvanized people and it started a movement, but there's such a much bigger discussion that needs to be had over the years, and the other issues that need to be taken care of are so much bigger and more complex. But we have to do that too. Like, if we want our kids to be healthier, we have to talk about where we get our food from, what kind of food, getting rid of the ultra-processed food, or at least most of it. We have to be eating fresh and local. We have to have minimized food deserts. We have to make sure there's a little bit more equality when it comes to food and healthcare. Like, there's so many bigger issues to health, but it does start somewhere. And if it started with dyes, then so be it. It's kind of silly, but that's what it was, and that's fine. I mean, I'm all for it. I think that's okay. but we have to move that conversation. And I think it's really important that people start to come together. And it's really easy to hate on people because they're talking about dyes or, whatever the latest, most in vogue thing is. But ultimately, we have to come together. And someone who says online, like, oh, you're talking about, this person's talking about dyes, but that's ridiculous because some people don't have food. Okay, well, get involved and help those people get better food. Like, that's what we need.
Right.
That's where we're going to get to a better place.
I totally agree. It's much easier to tear something down than build something up. So are you going to be a destructor or a constructor in life?
Correct. Exactly. Like, there's so long, like you said, like this, like it's so easy to tear the CDC down. You close it up, but that doesn't stop disease from happening. Like, we still need to focus on how do we prevent disease? How do we help people? But like we said when we were talking at the beginning, the answer is not to just give vaccines, right? That's not the only solution. There is a vaccine conversation and a medical conversation, and we have a lot of great pharmaceutical products, and that's fantastic. We live a lot longer than we used to. People used to live till 40, they live till they're 70. Wonderful. But life expectancy started going back down. Chronic disease rates are skyrocketing. We're not doing everything perfectly over the last 20 years. Let's be humble as doctors and physicians and healthcare providers and the medical community and health community in general and say, hey, it's not just about products, especially just vaccines. That's not the solution to measles, the only solution. Health is the solution. You have a medical product that can, yes, it can prevent you from getting something, but that's not the focus of our discussion. There have been, a couple of deaths in the last 20 years from measles. There are millions of deaths from heart disease. There, third of our kids have diabetes or prediabetes. These are also big issues. It's not either or. I feel like medical, like doctors get like they push back. If you're not talking about vaccines, like what are you? No, they could both be important.
Yeah. I mean, I think the operative word there that you mentioned is humility. And really, humility is baked into science. I mean, science not as a product, but really as a method, right? So hypothesis, observation, experimentation, deduction, modification of hypothesis, some form of conclusion, and then you do it all over again, right? And you build consensus and you peer review it, et cetera, but you keep asking why. And, in science, you should be rewarded for actually saying, I made a mistake, or I changed my mind, or look, new evidence appeared, and now we have a new consensus. And that requires humility. I think, like reading your book and being familiar with your work, really connecting to science, not as this product or this thing, but as this process and this method that has served us, pretty well, overall. If you look at the different avenues we have as a society to get to the truth of things, there's a jurisprudence method of like, okay, we have, a trial by a jury of your peers, and everyone presents their evidence, and there's a judge, and you hear expert testimony, et cetera. And then, depending if it's a civil trial or a criminal trial, beyond a reasonable doubt or preponderance of the evidence, there is some form of truth established. Journalism had a code of ethics in which there was independent fact-checking and multiple sourcing and core agendum, publishing of corrections, et cetera, which I know you're very, very connected to. You basically promised that with this book. Which I applaud. And then science had its method of getting to the truth, and we've abandoned some of the humility in that process. And I'm hoping that we can get back to it. And that's really why I'm a fan of your work, and not just this book. Well, I think vaccines are a very, very important topic, but almost not as a Trojan horse, that's not the right word, but like as an example of how we might actually foster more sane conversations and find compromise and middle ground and steelman each other and actually reiterate the best parts of our opponent's positions as a means to fortify your own, but also to find compassionate overlay. And so thank you for doing what you're doing, and I appreciate this conversation very much.
Yeah, thank you. And just to finish, I mean, whether you're on whatever side of any debate, especially when it comes to vaccines, everybody uniquely shares a love of kids and wanting kids to be healthy. And so if we can come together and have discussions, it doesn't have to be hostile. That's literally the only reason why I wrote the book, is just to have discussions like this, because if we can do this, we can make them the best, safest. We can make our kids healthier in the future. And that should be our only goal. Healthy kids, whatever we find with the research and data. And so I thank you for having me here.
Yeah, that we can rally around. Thanks a lot, Joel.
Thank you.
Yeah.
Hey, thanks a lot for watching. If you enjoyed this video, then I think you'll love this one too.